What are the signs of the stroke? In previous video, I described you a FAST scale, kind of very fast assessment of patients whether they have a stroke or not. But let's talk a little bit more in details about that. So obviously, if you have a stroke, you may develop a significant weakness on one side of the body. It is always one side of the body. When you have weakness on both sides of the body, it's very rarely related to the stroke. It may be, but it's extremely rare. Also, you may develop significant numbness on one side of the body, and it typically involves a face and arm and potentially a leg as well. You also may develop considerable speech difficulties. You're either not going to be able to speak completely, or you're not going to be able to find words. You'll have struggle finding words. In some patients, this will present with just very significant confusion. They're just confused and they don't know what they're trying to say. That they know inside of the head what they're trying to say, but it just does not come out. Or sometimes what comes out is complete gibberish. Also, patients may have a considerable disbalance. They may have this disbalance will be associated with significant dizziness and also with significant nausea and vomiting. If you have just dizziness, it may be related to the stroke, but it also may be related to inner ear problem. But if your dizziness is associated with weakness on one side of the body or double vision, then that is more likely to be a stroke, and that is very, very important to be assessed right away. There are other less frequent types of neurological deficits, but those are the most common ones. So again, if any of your loved ones or you will experience any of those symptoms, please go to emergency room. And in the next video, I will discuss what types of treatments we have for ischemic stroke.